Good afternoon, everyone. My name is Matt Van Stone, and I'm the Director of Media Relations and Public Affairs here at Geisinger. Thank you for joining our weekly COVID-19 press briefing. A few housekeepings as usual before we start. This briefing is taking place using Skype broadcast and will last 30 minutes. You'll be able to hear us, but we are unable to hear you. Dr. Ryu will make some opening remarks, and then we will take questions. Thank you to those of you who submitted questions in advance. We'll get to some of those following Dr. Ryu's remarks. And don't forget, you can also submit questions anytime during the event using the Q&A panel and Skype broadcast. Please share your name and outlet when submitting a question. As time allows, we'll take live questions submitted via the Q&A. And our media relations team will respond to any questions we cannot answer during our 30 minutes by end of day today. Following this briefing, a video recording will be available in the Media Resources Center we have established for journalists. That link will be provided for you before close of business today. With that, I'm happy to introduce Geisinger's President and CEO, Dr. Jaewon Ryu.
Thank you, Matt, and thank you to all of you for joining the press conference. We're happy to have this forum where we can continue to update you all on what we're seeing and what we're working on and why. This week's a little bit different because I think it's worth mentioning, and in the interest of calling out and giving a shout out to some of our folks, it's Nurses Week. Nurses Week started, I believe, 2 days ago or 1 day ago, and it extends over this next week. And it also happens to be Hospital Week starting next week. And so we have a couple celebratory weeks going on, and in particular with our nurses, it's a great time and a reminder for all of us with the 6,100 nurse employees that we have in our system. It represents 23% of our employee population, obviously a significant portion of the folks who work at Geisinger and do the fantastic work day in and day out to meet the healthcare needs of our community. I think it's also worth noting that, and we've mentioned this several times, during the COVID pandemic, there's been such an outpouring of support from our communities, whether it's the signs in the roads, the things written on the sidewalks, or just messages and notes of appreciation, the drawings from the kids. I think that all of that represents and is a testament to the fine work that our nurses do each day. And it's not limited to this pandemic. It's a neat opportunity for us to be reminded of that work, but that work predates and postdates anything related to COVID. And of course, it's got nothing to do with this 1 week where we celebrate our nurses and also celebrate Hospital Week. So I thought it's worth starting with that. And on behalf of our entire leadership team, want to give a heartfelt thanks and a shout out to our nurses. Shifting gears a little bit, as we've done with these previous updates for you all before, we're going to start with some of the data and observations and trends that we're seeing, and then move on to some of the other updates, and then we'll turn it over to question and answer. On the data front, these are numbers current through May 6th, so a couple days ago. We have tested at this point over 16,000 patients. We see about 18% of those tests coming back positive. That hasn't moved meaningfully, although it's crept up just a small tick from what we had been seeing before. We've also seen that of those who test positive, about 15% or so of those require hospitalization. And that number has stayed consistent. And so that ends up being about 420 patients thus far across all of our campuses that have been admitted to the hospitals. And of course, a portion of those, about a quarter, end up requiring ICU level of care. That also means that we've been discharging a lot of people because at this point we have right around 100, maybe a little less, hospitalized across our different campuses. And I think we hit a couple key milestones this week where both our GWV and GCMC campuses, the two campuses up in the Northeast, we surpassed 100 patients that we were able to discharge and send home because they were well on their way to making a successful recovery. And so I know that was great cause for celebration to the teams on those two campuses because that's a lot of people that have made great recoveries. Some more on the numbers I mentioned earlier. We have about 100 at this point that are actively admitted as patients in our hospitals. It turns out that we dropped down below 100 for the first time in a couple weeks. And so that's exciting news as well. It goes with what we've been saying all along. We think things have kind of plateaued is what it looks like, and maybe even showing the early signs of decreasing as far as the number of people who are positive and requiring hospitalization. But at the same time, we've been reminding people that it is not the time to let up. This is, if anything, it's the time to double down as elements of society and functions come back slowly. We know that the precaution efforts, whether it's the masking, the screening, the distancing, the hand hygiene, the trying to avoid touching your face, all of those things need to stay front and center in all of our minds, whether it's at Geisinger or throughout our communities. We have had about 35 of our patients in the hospitals are still in the ICUs, and about 130 at this point out of our 27,000 Pennsylvania employees, less than 1% have tested positive, and the vast majority of these, we continue to see that the exposure is likely to be outside the work environment. And we have also had a handful, I believe 6 employees hospitalized at this point, 5 of whom have made a complete recovery and have been discharged home, 1 who is still in the hospital at this point. I think, as we've emphasized before, there's a lot of data that you could be tracking with this. And we continue to emphasize to folks that the more local you can get the information, the more meaningful that information becomes. And so we've been trying to keep a very hyper-local focus. I mentioned earlier Luzerne and Lackawanna and the trends that we're seeing. We are seeing a gradual movement westward into other areas that we serve. And slowly we're seeing increases in case counts in some of those other areas, whether it's the Harrisburg market or even here locally in Danville. We have seen a gradual increase in the numbers. These trends are consistent with what our data analytics and predictive modeling teams have shown, which is that the curve has been flattened. It is a flatter curve, but it will be coming later, well into the summer months. That's a good thing. That means that our distancing efforts as a society, as a community, are working, but it also means that those things could change very quickly, and so we can't let up on those efforts. I think that's a summary of the data. A couple key highlights for you all as far as this week's updates. There's a lot in the news about, as of today, the state reopening segments of society with the blue, red, green color coding based on the geography and the county that you're in. Also, going alongside that, you see a lot of other health systems, as well as ours, reintroducing some aspects of the non-emergent services, whether it's procedures or visits that previously had been postponed or delayed or rescheduled and canceled. We are in the middle of that as well. What you'll see from us is a very phased and thoughtful approach around measuring out and prioritizing which of those cases make sense to bring back first, which ones are in a wave soon after that, which ones are in a wave soon after that. And we've actually already begun rephasing in some of those services. I think it's important to note, though, that along this entire journey, we have never stopped doing the clinically urgent services. And so folks who have care needs that have been clinically urgent, whether it's a procedure or an office visit, we have continued with that throughout this time. And of course, we also recognize that things that may have been not as urgent 6 weeks ago may now be urgent. And so there's a constant reevaluation that our teams of clinicians are doing to make sure that folks who have urgent care needs, we're still able to accommodate them. And even as we continue to phase our activities back, even some of the activities or services that are not as urgent, we're able to introduce those as well, because of course there's clearly some underlying health issue that needed to be addressed. While we're doing this, we're trying to keep safety as the North Star. And that's why it's a very measured and planned out approach. In fact, our multidisciplinary team that's been planning this out has been working on this for many weeks at this point. and we're just now putting it into motion. And it balances the considerations of clinical urgency, which I've been talking about, but also things like bed needs. Do these procedures require an inpatient stay? Equipment. Do we have the right levels of equipment and a good supply of those so that we're able to introduce these services at the same time staying ready and on the tips of our toes in case COVID makes some sort of a resurgence? The other is making sure that we have the right staffing, because as you know, and as we've talked about before, we've reassigned staff from areas where we didn't have as much activity and moved them into areas where we have a lot more activity. And that allowed us to adequately train and get our staff up to speed in the event of a surge around COVID. But now we're able to bring them back to their home base, so to speak. And we're planning all of that to make sure that we're adequately prepared, but at the same time, able to reintroduce a lot of these services. And so I think those are the kinds of things we've put into place and what you'll continue to see from us in the coming weeks. The other thing, as I've done in prior weeks, I guess the last comment I would make is that I think it's a good opportunity to remind folks that as things slowly reopen, this is even more important of a time to practice those precautionary measures, whether it's the distancing, the masking, the hand hygiene. All of those things are going to be critically important in order to open these various services and do so safely, whether it's in society or even health services here at Geisinger. And so we encourage everybody to do that. I know we've been getting out and about preaching that message, whether it's to others in the community, other community partners, community organizations, others who are willing to listen. We've been out there talking about ways that folks can do that, ways that employers can do that. I know there's been a groundswell of interest, and we're more than happy to help walk people through some tips on that. So we appreciate all of that, and I'll turn it back to you, Matt, as I'm sure we have some questions as we've had previously.
Thank you, Dr. Ryu. I'll actually start with a live question while you're talking data here. Can you clarify the gradual increase in numbers you've seen locally here in the Montour, Snyder, Northumberland, Union County areas? There hasn't been much of an increase according to state data. So Matt from WKOK was just asking for some clarification.
Yeah, so this is where you got to be a little careful with data. Data can be very tricky. The state data looks at testing data across the entire population. Of course, when we're looking at the Geisinger data, we're looking at just our patients and who is in our facilities. The number of cases or the number of patients that are COVID positive that are in our hospitals is the count that I'm referring to. And some of it has a little bit of murkiness because, as I've mentioned before, occasionally we do transfer patients depending on their need. And so some of the census numbers around the patients actively in the hospital today are clouded by the fact that some of them may have been transferred from elsewhere for certain services, as we do traditionally. I mean, this is something that's not new just based on COVID. But based on those, I think the census on our Danville campus, we've seen it creep up by 1 or 2. It's not a significant number, but at the same time, it's something we keep our eyes on. And then Harrisburg, same kind of dynamic where we've seen over time, you know, it ebbs and flows day by day, but I think they're not leveled off quite yet in the same way that we've seen with Luzerne and Lackawanna County.
Thank you. So also from WKOK, what concerns do you have regarding the state not supplying PPE to hospitals resuming elective procedures? How dangerous could this be?
Well, I think that's something that we've been very mindful of, as we've talked about before, really since January, as we've been planning for this. Our supply chain folks and our emergency preparedness folks, they've been planning around equipment and supplies and making sure that we're adequately stocked. At the same time, as we all know, that there's a worldwide shortage and challenges around some supplies. What we've been doing from day one is focusing on the appropriateness of use and educating each of our employees around the appropriateness of use of supplies. Also, as we've mentioned previously, the testing. Our ability to have on-site testing, and we continue to grow that capacity, has been instrumental because it gives us results back in hours instead of days. And when we're able to get results that quickly, that means we burn through less supplies and equipment because we're able to rule people out faster. At the same time, I'll give a shout out to our teams again. We got some really creative, innovative people that have been at the forefront of finding ways to either use things like 3D printing to access more supplies. We were one of the first places to have what is now an FDA-approved sterilization process of N95 masks using a peroxide-based spray process. And we were able to do that to be able to have a couple uses out of our masks. All of those efforts, and then of course the generosity of businesses in the community that have stepped forward with donations, both large and small, on equipment and supplies. I think if you take all of those things together, we feel pretty well positioned. But of course, this is something we monitor not just daily, but literally hourly. And there's a group of people that do that, and being able to rapidly adapt depending on what those changing circumstances reveal. I think that's been a big part of our game plan.
Great. One more from WKOK. Now that our area is in the yellow phase, how many additional patients are you anticipating, and any concern of being overwhelmed?
Yeah, I think this is another one where it's closely monitoring the scenario and making sure that we're staying agile and nimble. And to the extent that there are more cases, I think we're making sure that we have the capabilities and the capacity to take care of them, as I referenced earlier. I think the other is, this is exactly why I couldn't stress to you enough, there are safe ways to reopen segments of society. We firmly believe that, but to do so requires all of us in the community to be paying attention to those same precautionary efforts that we've been doing a pretty good job at over the last handful of weeks, to be honest. That's what's gotten us to this spot, and we need to continue those efforts and make sure that our local stores, our local community members, they're still paying attention to the distancing, the masking, the washing the hands, all of those things, avoiding large gatherings. And this is not the time to be thinking everything's back to normal and we're out of the woods. That cannot be further from the truth. We are not out of the woods. We still have a lot of work to do. This is going to be a marathon, not a sprint. This is a journey. And in order to make sure we can keep progressing on the journey, we need everybody to pay attention to those efforts.
From the press enterprise, is there anything new to report on the employee layoff or furlough front?
No, I think, I forget if it was last week or the week before, we said, and we summarized, but I think it is worth repeating because we're, about a week or so further out. But we had initially, very early on, made a decision to essentially keep everybody whole from a pay standpoint through April 25th. And that bought everybody time so that they were shielded from any of these effects, while at the same time, our focus has always been on reassignment of our staff. And we know that there are areas of our operations that have less activity, and then areas of our operations that have more activity as a result of COVID. And we've been trying to reassign as many people as possible from those areas of less activity to the areas of more activity. And that's, at this point, almost, I think it's approaching 2,000 of our staff that have been able to be reassigned in that way. For those who can't be reassigned, after that April 25th date, what we've been doing is that people can use a variety of options, one being their accrued or banked vacation time, another being that they could borrow against their future vacation time up to 80 hours. They could also go to donated vacation time, as we've seen just an abundance of generosity at this point within our own Geisinger employee base, folks donating vacation so others can use it. I think we've seen over $328,000 of donated vacation time. And so that's been another neat lever for folks to rely on. And then unpaid leave can be sprinkled in as part of that as well. And through all of those various efforts, we've been able to extend people a lot of options. And again, those are areas that, and people that couldn't be reassigned. As we reintroduce more services as well, that number of who can't be reassigned, that'll be less and less. And so we're going to continue to monitor the situation, but that's been our approach thus far. And, you know, knock on wood, it's been working pretty well at this point. Although obviously the impact is still there, and, you know, I think that can't be glossed over either. We know that there's impact as a result of this, as there is impact pretty significantly on the organization as well.
From the Clinton County Record, Pennsylvania House Republican leadership submitted a letter upset about bed occupancy rates being low. What about their comments on elective procedures and the view that hospitals are facing financial collapse? Is this read accurate?
So again, I forget if it was last week or the week before. Memory's failing me here, but I think we discussed previously, we had estimated from early on that the financial impact to Geisinger as a whole, as an entire organization, we were probably looking at about a negative $100 million impact every month. And some of this could be offset if we reintroduce certain functions and so forth. But generally, that was the rule of thumb thinking as we were analyzing this. And now here we are 7 weeks in, and that's been tracking right along with that estimate. So the financial impact on hospital systems and health systems is significant. There's no doubt about that. Some of that has been offset with the government grants. I think folks are familiar with the CARES Act that got passed early on in Congress, and that did help to offset some, but certainly not a significant portion of that shortfall. And so the impact is still going to be there. I think the lens that we have viewed this on, and this is why we've been so thoughtful about how we're thinking about reintroducing services, is that finance is not our guide. And it's about clinical care. It's about safety. And we know that those things are far more important. We are lucky in that we have a balance sheet that can help us weather some of these storms, albeit significant storms. But it allows us to really focus on making sure that our North Star as we do this work is around how do we do it safely and how do we make sure that the needs of the community are met. I think this gets back to some of the earlier question as well, where someone asked about, well, as this is now, or as parts of our areas are now in yellow, do we anticipate more activity because people may have more exposure to the virus? Well, there are also a lot of healthcare needs that are out there. We know that as we postpone services, and we did that fairly early on, 6 weeks ago or so, as we did that, those care needs didn't go away. We know that the person with the bum knee, that bum knee didn't miraculously get better. They're going to need treatment. The person with gallstones, those gallstones didn't go away. We have to go address those things. The person who needed the colonoscopy, that need didn't go away. That still needs to be addressed. The person with congestive heart failure who needs to be followed up in clinic, we've done a lot of that through rapid growth in our telemedicine programs. But at the end of the day, they're eventually going to need to come in for that echocardiogram. All of these kinds of things, that's how we've approached it. Yes, there is a financial impact, but the clinical need is really what's weighing on us more heavily, as it should, and that will remain our priority. And so as the team has been looking at how to phase in those services, we've had the clinical questions be our guide.
Thank you, Dr. Ryu. We don't have any more questions from members of the media. I know we're a few minutes short here, but with no more questions, we'll wrap. Thank you very much. Happy Mother's Day to all the mothers out there, and have a great weekend.
Thank you, Matt. Thank you, everybody, and happy Mother's Day.